You've heard it's going around. The stomach virus, COVID, cold, and flu. And it's true. Add RSV and whooping cough to the list, and we're in the thick of germ season. Today, I'm going to tell you the truth about how germs spread and how you can stay well and avoid catching them. I'm Dr. Vicki Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you. This is a special edition, the ultimate guide to avoiding sickness, how to stay well during cold, flu, and stomach virus season. 'Tis the season to be coughing, catching all the germs, and getting sick. Woo! There really is a lot going around right now besides my bad singing. So, how can you keep from getting sick? Stay tuned to find out more about preventing the spread of the stomach virus, the common cold, flu, RSV, whooping cough, and COVID. You've probably heard that the stomach bug is going around. The most common cause is the norovirus. And January is typically flu and RSV season, although some of that got thrown out of whack during the pandemic. But right now, levels are moderate and COVID levels are high. And here's the deal. All three are increasing, and this is not unexpected. Why is that? Well, because of all the travel and family gatherings. The number of people you are in close contact with on a daily basis usually consists of your immediate family, friends, and coworkers. But over the river and through the woods, all those germs are coming to gather at grandmother's house to spread like wildfire. In this special edition episode, we're going to talk about how these 6 infections spread and what you can do to prevent it. But first, we need to go to mini medical school and learn about viruses and bacteria. Pop quiz. Of the 6 diseases I mentioned, all but one is a virus. Do you know which one is caused by a bacteria, norovirus, the common cold, flu, RSV, whooping cough, or COVID? Not sure? Well, listen close. I'll tell you as we review each one. But first, some basics. What is a virus? Well, it's a fragment of genetic information like DNA or RNA, and it's inside this protective shell that's called a capsid. And a lot of them look like this ball with these spiky things on it. And they don't have any cells, and they're tiny. Their goal is to perpetuate, and they need a host to reproduce. And humans, well, we're so hospitable. We work great. And first, they attach to their host, and then they enter the host, and then they start replicating inside the host. Then they assemble more viral particles and whoosh, release them. And that, my friends, is a very, very brief overview and simplistic overview of how they make you sick. Oh, and one more thing. If you have a viral infection, an antibiotic will not do one frazzling bit of good. And that's what it says in all the medical textbooks. Not one frazzling bit of good. And I know you want an antibiotic because you've got a lot of things to do and you want to get well fast. And if you go to urgent care, you can probably snag a Z-Pak pretty easily. But if you have a viral infection, it won't do what? That's right. Not one frazzling bit of good. Now, why am I so passionate about that? I'll get to it in a sec. But let's first talk about bacteria. They're different. They're also tiny, but they have a single living cell. And some bacteria are actually good and they keep you healthy. And that's right. That's why taking an antibiotic when you don't need one is bad for you. Because if you kill off all the bacteria in your gut, that upsets the gut microbiome for a long, long time. And what happens in the gut microbiome? Well, that's where neurotransmitters are made. It's where the immune system is regulated. I have some links in the show notes from previous episodes if you want to learn more about how the gut actually affects your brain and your mood. Now, on the other hand, if you do have a bacterial infection, you need an antibiotic. Okay, got it? Antibiotics are for bacteria, not viruses. And there are antivirals, but we're probably not going to talk about that today. But let's move on, starting with the stomach bug, which really isn't a bug at all. And I bet you already guessed that the stomach virus is caused by one of those spiky little pieces of genetic material that needs you to be its host. The most common cause of the stomach virus is the norovirus, and this one spreads easily, so it's super contagious. Because here's the deal. People with norovirus infection can shed billions of invisible viral particles. That's billions. But it only takes a few to make you sick. And it doesn't really seem fair to stack the deck that way, especially since the end result is diarrhea, nausea, vomiting, and stomach cramps, and possibly headache, body aches, and fever. And you get it from sick people, contaminated food or water, and surfaces. Now, that last one's really important, and that's the reason that I always use the little wipes to wipe down the handlebar of the grocery cart. And I wash my hands as soon as I can. And once you're exposed to the norovirus, it takes about 12 to 48 hours to get sick. So it usually makes the runs through the household pretty quickly. Want to know something else? You can get infected with norovirus by ingesting little bitty tiny pieces of feces or vomit from an infected person. Yeah, Mom and Dad, that's why you're at risk when little Johnny brings this home from school. All that barehanded cleaning and caring for your sick, splattering little one puts you at risk for going down for the count too. Your biggest defense is wash your hands with soap and water. Wash them often and wash them good. And keep your hands out of your mouth, eyes, and nose. This virus grows really nicely in big petri dishes, otherwise known as cruise ships. And that's why they installed 974 hand sanitizer stations right in front of the food troughs. But here's the deal. Hand sanitizer doesn't really work that great for this particular virus. Turns out good old-fashioned hand washing is much better. So maybe that cart wipe that I'm using isn't doing much good, but it certainly won't hurt. Anyway, be careful what you touch and keep it out of your mouth and nose. Wash your hands. Now let's move on to the common cold. Quick question, virus or bacteria? You got it, virus. Specifically, the rhinovirus. And remember, rhino means nose. And it's also a type of coronavirus. Yep, that's right, coronavirus, first identified in the 1960s and effectively killed by Lysol. Says it right there on the label. Next question. If the common cold is caused by a virus, will an antibiotic help you recover faster? Nope. Can it hurt? I hope you said yes, and if not, go ahead and hit rewind. The symptoms of a cold usually last less than a week, but can last up to 2 weeks. And they include runny, stuffy nose, headache, body aches, sore throat, fever, coughing, and sneezing. There's a link in the show notes on how to differentiate a cold from allergies. But different viruses are spread in different ways. The common cold is spread through droplets from an infected person, and they find you when that person coughs or sneezes. You can breathe them in, or you can get infected by touching a contaminated surface, then touching your eyes, nose, or mouth. That's why it's recommended that you cough or sneeze into your elbow. Because if you cover your mouth and nose with your hands and then shake hands or touch something or a surface, then the virus uses that as an opportunity to hitch a ride onto someone else's hands. Then, if they touch their eyes, nose, or mouth, they're infected. So wash your hands and keep them out of your mouth, eyes, and nose. Another virus that spreads by droplets is influenza. These droplets are spread when people with flu cough, sneeze, or even talk. You can also get it from touching surfaces than touching your mouth, nose, or eyes, but that's actually less common. Most of the time, you catch it directly from another person. These little viral particles are within droplets that land right in your mouth or nose. And relatively speaking, these droplets are kind of big. They're greater than 5 microns in diameter, so they don't really travel far because gravity just pulls them to the ground within about 3 feet. Now, once you're exposed, the virus goes to work pretty quickly, and you typically get sick a couple of days later. Now, flu season is definitely upon us, and it's spreading. When I was young, my mom had the flu, and she said she thought she was going to die and kind of hoped she would. Now, personally, I don't ever recall having the flu, but it's serious. It can be fatal. And there are lots of different types of flu, and some cause more severe illness than others. So far this year, there have been 9 pediatric deaths, and it's early in the season. 3.1 million cases of flu have been reported, resulting in 37,000 hospitalizations and 15,000 deaths. According to the CDC, flu is on the rise. How do they know? Let's take a look at how the data is collected because it might surprise you. They look at emergency room visits, hospitalizations, and the number of tests done for certain diseases and the percent positivity. And there are benchmarks for those. But that wouldn't really give us a total picture, would it? Because some people don't go to the doctor or the hospital. Want to know a secret? They're looking at your poop. No, not yours individually, but collectively. They study wastewater and test feces for these viruses. I mean, it's kind of brilliant, albeit really gross. They even have a poop dashboard. Of course, they have a more sanitized name for it. It's wastewater data. There's a link in the show notes if you're interested or if you don't believe me. And honestly, it's pretty fascinating if you're ready to geek out. I just wonder if they advertise on LinkedIn, looking for a CPA, a Chief Poop Analyst. Qualifications: must understand virology, statistics, and have a high tolerance for gross things. And maybe they got the idea from Teenage Mutant Ninja Turtles. Who knows? Okay, enough of that. Now, we call influenza flu for short. And moving on, we call respiratory syncytial virus RSV for short. And the normal RSV season is late fall to winter, though that again was thrown out with a lot of other things during the pandemic. Want to guess how it spreads? Just like the flu and the common cold, RSV spreads through droplets. You already knew it was a virus. I mean, it's right there in the title. But it's the same old viral tactic. Somebody who's infected coughs or sneezes. The droplet travels the short distance between you and you breathe it in. This virus can survive on hard surfaces like door handles and tables for many hours. So if you touch it and introduce it into your mouth, nose, or eyes, it can spread that way. It can also live on your hands or a used tissue, but not for very long. So what should you do? That's right, wash your hands and don't touch your face. Now, this is important. RSV can infect anyone at any age and more than once in their lifetime. In fact, nearly everyone gets it before their second birthday. But here's the deal. Babies can get really sick from it, and you can give it to them by kissing their face. So yeah, Grandma, this is one reason that new moms tell you, don't kiss my baby. The other is the herpes virus, which causes fever blisters, but it can be fatal to newborns. RSV can cause severe illness, hospitalization, pneumonia, and death in older adults too. So if you're sick, stay at home. Seriously, don't share your germs. When it comes to respiratory viruses, clean air also helps. That means HEPA filters for indoor air, or if you live in the South, you can probably open some windows, except maybe those 13 or so days when we get bitter cold and ice. Anyway, just wash your hands and cover your mouth and nose when you cough or sneeze. Spray the Lysol, keep your distance, wipe down the surfaces. There's just not a lot of variety in these recommendations, and following them just might protect a vulnerable little baby or a precious elderly grandma. And that logically helps me segue to COVID. You knew we were going to talk about COVID, didn't you? Transmission rates are really high right now. And here's a test I bet you'll ace. Is COVID a bacteria or a virus? Bingo. Let's go a step further. COVID-19 is a coronavirus. And remember, there are lots of different kinds. But there is something very unique about COVID, and that is how it's spread. And hopefully you already know this, but let me remind you that COVID-19 is not spread the same way as the common cold, RSV, or the flu. And this is one of the things that made it so scary and dangerous. You see, COVID is airborne. Instead of hanging out in big, heavy droplets that fall quickly to the floor, it floats along through the air. So you can literally get it from someone who isn't even in the same room with you. Think about a small bathroom where someone has coughed and then you go in, breathe in the little viral demons, and get sick. It even traveled through ventilation systems in heavily populated apartment complexes. For the most part, the COVID virus spreads among people who are nearby. Basically, talking distance, coughing, sneezing, singing, and even breathing distance. And the louder you talk or sing, the further these little particles travel, and we call it aerosolization. I mean, think about hairspray in an aerosol can. You spray it, it gets on your jewelry, the mirror, your glasses, your husband comes in and starts fanning the air. Except these particles aren't big enough to declare their presence floating in the air. Depending on the ventilation, airborne diseases can travel more than 6 feet and hang around for hours floating in the air. Fortunately, there are not a lot of airborne diseases, but there are a few, like tuberculosis and measles, which is also on the rise and will likely continue to increase. Remember when we didn't know how COVID would spread? I traveled to my daughter's during that time to see my grandbaby and drove 8 hours without stopping to eat and only once to get gas and go to the bathroom. I wore gloves and an N95. I never got into washing my groceries, but I did wear an N95 a lot. Plus, I worked in a hospital, so there's that. Now, you can touch a contaminated surface and get COVID through your eyes, mouth, and nose, so do the drill. Wash your hands, don't touch your face. But it's that airborne aspect that made it different, besides the fact that it was a novel coronavirus and we just didn't have any immunity. The pandemic highlighted the need for America to get healthy, too. Obesity was associated with poorer outcomes, and now we have GLP-1 agonists, which are helping people control obesity because it's so much more than willpower and determination. I put a link in the show notes about GLP-1 agonist and obesity, but listen, we still need to be physically active and eat whole food. Now, we've talked about 5 viruses: norovirus, rhinovirus that causes the common cold, influenza, RSV, and COVID. But what about whooping cough? Virus or bacteria? You guessed it, whooping cough is caused by pertussis bordetella. And this bacteria is very contagious. It spreads easily through the air when someone coughs. And boy, do they cough. Sounds like a big wheeze before this violent coughing fit and a shower of germs. And here's the deal. It lasts a long time. And people are contagious for 2 weeks. And that cough, it can linger for months. So you may be wondering, if it's a bacteria, should you take an antibiotic? And the answer is yes. But for this one, you've got to take them early. Now, not everyone gets that classic whoop that gives it its name. Some people just get a little tickle and a cough, and maybe they don't even know they're sick, or their doctor tells them they have bronchitis or a sinus infection. And those are the ones you've got to watch out for because they can spread it. And like RSV, in babies, it can be life-threatening. Babies don't cough, they quit breathing. And 1/3 of infants less than 1 year old who get whooping cough require hospitalization. Wow, that's serious. And that is why when I was practicing obstetrics, I always recommended that my pregnant patients and everyone who was going to be around the newborn get a booster shot called Tdap. It stands for tetanus, diphtheria, acellular pertussis. Now, let me stop right there, and I want you to hear me. I really wanted to do this episode because promoting health is the whole goal of this podcast. I want to give you information, motivation, and inspiration to take measures to protect and improve your health. When it comes to seasonal illnesses, it's important to have a good baseline health and a strong immune system. That means a healthy gut microbiome, a healthy weight, and controlling risk factors like diabetes and hypertension. I really care about you, and I have no intention of wading into controversial waters. So, if you have strong emotions when it comes to vaccines, just hit the 2 double vertical lines right now and push stop on this podcast. But I really do care about you, and I'm going to keep this part really short. But if you want to have a further discussion about vaccines, I will literally schedule a call with you. Just email me, drvicky@healthylooksgreatonyou.com, and we can talk about it. I'll put a link in the show notes, but feel free to email me. It's drvicky, VICKIE, at healthylooksgreatonyou.com. You can also find that information on my website. And please don't send me hate mail, but if you do, I'll respond with love and grace, because I don't want this information, which is rooted in solid science, evidence, research, medicine, and statistics, to interfere with our relationship. I'm not asking you to respect my opinion or anyone else's, because this is not about opinion and it's not about respect. But you see, that is something that changed with the pandemic. Distrust was sown. And maybe deserved. Maybe there was something nefarious, but there was also a lot we just didn't know. And as we learned, and we learned quickly, things changed. Anyway, talk to your doctor is the best advice I can give you. I remember when the chickenpox vaccine came out, my son was 2 years old and he had asthma. And I was a little leery because it was a new vaccine. I talked to my pediatrician and he advised giving it. 2 years later, my son's preschool had to shut down because every single kid had chickenpox, except my one little vaccinated boy. They even had to cancel preschool graduation because, yeah, that's a thing. But instead of telling you what I do or what I know or how I feel, let me preface all of this by saying I've been a medical doctor for 3 decades. I was chief medical officer of a hospital for 7 years, including the pandemic years. And I know what I saw firsthand. I do a lot of research from reputable sources for each podcast episode. So if you trust me, keep listening. But again, if you have strong feelings, now is the time to stop listening and you can tune back in next week. We'll pick up on the dementia series and talk about things we can agree on. I mean, we don't all have to agree on everything to be friends, do we? Okay, I already told you that I recommended that all my pregnant patients get Tdap to protect their babies. And this is based on recommendations from the CDC, the American Academy of Pediatrics, and the American College of Obstetrics and Gynecology, all reputable organizations. They also recommend the flu shot. Now, vaccine reactions are real, but they're rare. I don't personally know of a pediatrician who does not vaccinate their children. They see firsthand what these infectious diseases can do. Now, I'll admit, doctors have various opinions because they have various perspectives, and we call that bias. Think about it. If a doctor only works in an outpatient clinic, they may have tons of experience treating some infection, and what they do supports their beliefs. But they don't know what goes on in the emergency room or the hospital. And the doctors that do have a different bias. And this was especially true during COVID. There were a lot of sayings that went around during COVID, like, what about the obesity epidemic? Why are we not talking about that? And I think we should be talking about it. Or, what happened to the flu? Did it suddenly disappear? Well, it turns out that social distancing, washing your hands, wearing a mask, avoiding crowded places, yeah, that prevents the flu too. It's recommended that everyone over the age of 6 months get a flu shot. And if you're concerned about mercury or thimerosal, you'll be glad to know that single-use vials of the flu shot don't contain any and haven't in many, many years. Now, remember I told you that I've never had the flu? You see, after my mom had it, she made sure we were vaccinated every year. And I continue to get the flu shot every year. I gave it to my kids every year. It is a killed virus, and you cannot get the flu from the flu shot. And yes, I know you may have gotten a flu shot and then gotten the flu. And there's several reasons for that. Number one, the vaccine typically is only between 40 and 50% effective. Number two, it takes a couple of weeks before it works. And you might have gotten exposed to the flu right before you got the vaccine or right after, before your immunity kicked in. You may also get the flu right after you drink a Coke. But that doesn't mean the aluminum can caused it. And I'm sorry if that was a little snarky, but correlation does not equal causation. And that's super important when you're looking at data rather than anecdotal experiences. I remember how excited we were at the hospital when the COVID vaccine was delivered. I even took a video on my phone. It made a huge difference in the death rate we were seeing. And as soon as it was available, I got the COVID vaccine and all the boosters until the virus mutated enough to not really cause severe disease in most healthy people. I would still get it if it prevented COVID, but unlike what we thought at first, the COVID vaccine does not prevent COVID or the spread of COVID, just the severity of the disease, hospitalization, and death. Not that that's not important. The RSV vaccine is recommended for people age 60 and over, and there is a form of it that's available for newborns who are at risk. Again, Tdap is recommended for pregnant women during every pregnancy and for anyone who's going to care for the baby. Vaccines in pregnancy, like flu and Tdap, are given later so that those maternal antibodies can help protect the baby when they're too young to be vaccinated. And listen, I know attitudes have really shifted about vaccines. I remember when I was in the second grade, they lined us up at school and shot us in the arm with the same air gun to vaccinate us against smallpox. Remember smallpox? That disease has literally been eradicated from the face of the earth by vaccines. We all got it at school, and I'm not even sure our parents knew we were going to get it. But my mom is an ardent supporter of vaccines. Want to know why? In a word, Shirley. You see, she had a cousin who was in an iron lung at the age of 17 from polio. It was a dreaded disease, and the vaccine was a huge victory against this debilitating illness. I guess people have a reason for believing what they believe. If you've seen devastation from an illness or from a vaccine, you're going to have strong feelings, and rightfully so. I've seen what I've seen, and you've seen what you've seen, so please send me an email if you want to continue the conversation. But I think we can all agree, keep your germs to yourself, wash your hands, get some fresh air, don't touch your face, and stay healthy, because healthy looks great on you. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.